I mean, we're talking about, I think it's in the neighborhood of 25 billion over 10 years on the Medicare, to expand Medicare coverage of these drugs. Now, that is a big number. It is in context. Medicare will spend $2.1 trillion on prescription drugs in that period. So it's a relatively small portion of the total spending.
Okay, but that's only part of the story here, because at least the folks in the administration, they say, okay, yes, it's a big upfront cost, but this will essentially pay for itself and more as a result of what these drugs are supposed to do, right?
Well, that's one theory. I don't think, to be clear, I don't think anybody is claiming that these drugs will pay for themselves, right? I think there are a couple of different ways you can look at it. One is that the benefits from these drugs are worth the cost, right? That people live healthier lives. They will prevent potentially worse health outcomes down the line in terms of diabetes or stroke or cardiovascular disease. But all that is sort of like very uncertain, I'd say, right? So when the government's actually kind of like doing its cost estimates on this rule, they're not actually counting any of those sort of future offsets from the cost. They're just kind of looking at how many people do we think would take these drugs and what will it cost.
John, didn't you get the memo? It's, these drugs are going to solve everything that ails us. I mean, we've joked with, I think you and also Madison Muller, who covers it as well, and it's just like, it seems every couple of weeks there's something new, right, that they're finding that by taking these drugs, and maybe it just speaks to being less heavy is a good thing for our overall health.
Yeah, I mean, I think that's part of the argument that the Biden administration is making here. They're saying, traditionally, Medicare is prohibited from covering weight loss treatments. They were sort of seen as, a lifestyle problem, and Congress actually kind of barred Medicare from paying for drugs like these. Now, the Biden administration says it's operating under a new interpretation of that law, and they're saying, the medical evidence has sort of evolved, and there's a growing understanding and acknowledgement that obesity in itself is a disease that should be treated.